Transarterial embolization is a generic catch-all term meaning working through an artery to embolize or restrict or limit blood flow to a specific part of the body. So there's not really a specific procedure called TAE or transarterial embolization, but it applies the general principles to various parts of the body. So with plantar fasciitis, patients typically will have severe heel pain that is worse when they walk or try to run, and it limits their life significantly because a lot of them don't walk or run because of the pain, and they don't get their 10,000 steps in sometimes. And so when we do a procedure for plantar fasciitis, we're doing what's called a plantar fascia embolization. And we're just working through a little pinhole, whether it's in the wrist or right above the hip, typically right above the hip or near the foot. And through that pinhole, we'll thread a little catheter, a little tube, and then through that tube, we'll identify the abnormally developed blood vessels in the heel that need to be embolized. Once we do that using very sophisticated imaging technology, we then proceed to embolization. Embolization requires the injection of small particles. They're about the size of grains of sand, and those particles will plug up the abnormal blood vessels in the heel and then restore that blood flow back down to normal so things can essentially cool off. The inflammatory cycle is broken, and the patient will ultimately receive pain relief after a few days or after a few weeks. The best part about it is the pain relief is not temporary. It can last for a long time, several years in fact. So that's the ultimate goal, is to provide them quick pain relief that can last a long time.